Hi, this is Lavina Sabri with So Natural, speaking on healthy living. I am coming to you one day post-op for my total thyroidectomy, which was done yesterday. I have on a microphone, so I hope that you can hear me. My voice is a little hoarse because of the intubation that they did yesterday. I just want to tell you about my experience. What happened was I was in Scott and White Hospital in Temple and went to the surgery. We had to be there at 8:30. They sent us upstairs to get changed, and they came in and they started the IV. The anesthesiologist came in and they talked to me, and they told me that normally the way that they perform a surgery or get you ready for your anesthesia, your general anesthesia, is that they put you under and then they intubate you. But because of my thyroid was so big, they had to do it the opposite way around. So what they did initially was sedated me and then tried to intubate me and then put me under the general anesthesia so I can have the surgery done. He told me that I wouldn't remember or understand the things that was going on, but I did remember and I understood the things, what was going on, but he told me that was the best way to do it. And I am so happy that it was done that way, because they had a hard time getting it in that way. So I know that if he would have done the anesthesia first and then tried to intubate, it would have been difficult. And with you all knowing, well, you may not know, but that is actually life-threatening, because once they give you the anesthesia, your lungs stop breathing. The intubation is what breathes for you. So the last thing I remember is gagging and trying to pull out the tube, but the nurses, they were holding my hand, so I couldn't do that. And then I seen black. I went to sleep and I woke up in recovery. And when I woke up, I wasn't in any pain initially, and but I was very sleepy from the anesthesia. And the surgery, my surgery for me, it took about 3 hours. But it also, I stayed in the recovery room for about 3 hours because my blood pressure was really high. It was in the 190s, over 100. So it took some time for it to get it down. And also, again, I was very groggy and very sleepy. It was hard for me to wake up. I didn't completely wake up to where I was able to keep my eyes open and function until about 10:30 at night. And once I woke up, I'm gonna take off my scarf again so that you all can see what is going on. So I have an ice pack on, and then this is my incision. I still have my the bandage on. They told me that I can take it off to tomorrow. And the reason why I had an ice pack on is to keep the incision from swelling. And then I also have a drain, and the drain is here, and I have the ice on there as well because it hurts so bad. And the pain medicine is not helping this. It's only helping the incision, itself. For me, it hurts for me to swallow. It's a little sore when I swallow. And my left hand, it is numb from when they, after they give you the anesthesia, they put your arms underneath you so that in case you wake up, they have that done. So my fingers are still a little numb and a little swollen. And but other than that, that was it. I had Jasmine as my recovery room nurse. She was awesome. She made sure that she took care of me while I was there. And even when she took me upstairs, I was still a little groggy, and she stayed up there and help the other nurses until, you know, I was settled in and everything. And I really appreciated that. The nurses that I had last night were Robin. She was like the clinical, I think, coordinator, and then Jordan was my nurse. This morning I had Raquel. The doctor I had for the surgery was Dr. Milan, and she had some of her fellows, you know, that was working with her. Overall, I had a really good experience. Although I was very afraid of doing this, I am so thankful that I did it, because it was huge. My thyroid, it was about 12 centimeters, so it was very huge. They told me that I would be hoarse for a couple of weeks. My voice is really not that bad, but they told me that I'll be hoarse for a couple of weeks. And then they also told me that I will have the pain in my neck area, because like I said, the thyroid, it was so big, like sticking out and everything. They are giving me calcium because they don't think that they nick the parathyroids, and my calcium levels are high. Not high, but they're within normal limits, but they just want to make sure that they give it to me just in case. So right now my medications is basically pain medication and calcium, and then I'll be starting Thyroid on Monday. But if I start to feel like any hypo symptoms, and some of the hypo symptoms are cold intolerance, where you can't stand up. Oh, sorry, that hurt. I have a hiccup, but cold intolerance is one of the, excuse me, cold intolerance is one of the symptoms that I felt. I was very sleepy when I felt the hypo. I wasn't hungry. I didn't use the bathroom. So if I start to feel any of those, I was informed that I can go ahead and start taking my Thyroid. Basically, I just wanted to get on here and explain to you what my experience was with having the thyroid surgery, what happened before, and what happened directly before the surgery, and what happened afterwards. At first, they had me on clear liquids, so I was drinking juice and water all throughout the night, and basically all throughout the night. You don't get an opportunity to sleep because you have the nurses coming in there, checking on you, giving you your meds. And then because I was at a fall risk, I couldn't get up to use the bathroom. So they had to come and assist me with that. And then you also had respiratory coming in to do the incentive spirometer. And then what else who else came? Oh, and because of my blood pressure was so high, they also had me on for cardiac. So they had me on telemetry so that they can monitor my heart. So someone came in for that. But all throughout the night, there were people coming in. So whenever I did try to fall asleep, I was either in pain or someone was coming in, and I just didn't get an opportunity to sleep. I just got home not so long ago, so I just wanted to come on here really fast and let you all know about my experience. If you will, please like and share this video. If you know anyone with thyroid that's going to have thyroid surgeries, if you have any questions or any comments, you can leave them below. And thank you again for watching. I'm Lavina Sabri with So Natural Healthy Living.